Okay, good evening. Good evening, all, and welcome to the Kajiado We Want YouTube channel. And thank you very much for everybody who has joined in this evening. And I want to just express my personal gratitude and gratitude for the entire CBO, for everybody who has joined in this evening. We have an amazing guest. We have an amazing conversation up ahead, and I look forward to hearing more from our guest and also from you, our listeners. We encourage you to be engaged, and please send through all questions you have and any comments that you have. We're really looking forward to a very highly interactive and engaging session. And so I'll begin by introducing the CBO. Sorry, I'll just introduce the chair. David, are you here? Are you able to introduce the CBO? David, okay, not a problem. I think he's experiencing technical challenges, so I'll just take on from here. So the Kajiado We Want is a CBO that focuses on community development matters in the following areas: infrastructure, and this includes roads, street lighting and drainage, water and sanitation, health and drug abuse, education and literacy, environment, waste management, land use and climate change, trade, industry and job creation, advocacy for youth, women and children, security and community policing. We aim to achieve development in the above areas by creating awareness through covering topical issues tackled by experts every Wednesday on our social media handles, such as what we have today, lobbying government through public participation, memoranda, petitioning and picketing as a last resort, and lastly, through creating partnerships with individuals, associations, entities, non-governmental organizations. This group is not political and does not support any political leader against others. Neither is it aimed to support anyone's political ambitions. We work with all leaders, elected and non-elected. Key values required of the CBO members are volunteerism, commitment, integrity, and respect for others. Membership is drawn from all the sub-counties of Kajiado. Feel free to engage and participate on matters that bring development to our county. And thank you, and we look forward. If you want to learn more about how to join the CBO, you can reach out to us at the end of the session. You can just put it in the chat, and we'll be more than happy to bring you on board. And now, next, we bring in our amazing speaker, and we have an amazing topic. And our topic of today is why palliative care. Who needs palliative care services? Is it available in Kajiado County? And our speaker is none other than Stella M. Rithara. She's a registered nurse. She has a higher diploma in education, a postgraduate in palliative care, an oncology and geriatric nurse. She's a trained community educator. Stella is experienced in clinical palliative care, nursing with over 10 years at Nairobi Hospice, and has 11 years teaching palliative care. She's a Rotarian servicing the community. She has worked in very amazing positions. For example, she's a board member of the International Association for Hospice Palliative Care. She has done pioneering in public health palliative care nursing at St. Christopher's Hospice in the UK. She has been a trainer and mentor for the Institute of Palliative Medicine in Kerala, India, and also a Global Alliance member for the Advanced Breast Cancer. She's also a founder and director of Ongata Ngong Palliative Care Community-based organization, which is whose purpose is to educate and create awareness on palliative care across communities. She's also a founder and director of UBORA Health Care Services, a home care health services with trained nurses at home, caring for the sick with life-threatening or life-limiting illness. And so with that, I would like to welcome Stella. And thank you so much, Stella, for taking the time. This is such an amazing conversation. I look forward to hearing from you. And also I look forward to having a highly interactive and engaging session. Karibu sana.
Thank you so much, Aris, and also the leadership of Kajiado We Want for this opportunity to talk about palliative care, which is a specialty in the medical field, which most of people, they don't understand what is palliative care and where we can get the services. For today, I want to just to create awareness of what is palliative care, the people who requires palliative care, where can we get palliative care services, and are we as Kajiado members, are we able to get the service in our Kajiado? With that, I would like to start sharing my presentation on what is palliative care and what we are doing as a community, Ongata Ngong Palliative Care Community and UBORA Services. These are CBOs, like Ongata Ngong Palliative Care is a CBO aiming at creating awareness in the community and also training community health volunteers, community members, caregivers, family members on how to take care of their own. We know, all of us, the hospitals, our health system is not able to accommodate everybody in the hospital as inpatient. Majority of our patients, community life-threatening or chronically ill patients, mostly they are at home. And when they are at home, they require healthcare services. And that's why palliative care comes hand in hand, training the family members or the carers, neighbors, or friends. Or sometimes we go with the organized communities. Welcome as we move on.
Thank you, Stella. Kindly share the presentation again.
Okay. Benjamin, can see it on your side?
No, I can't see it.
Wow, a bit. Sorry for that.
It's okay. Let's proceed with the PowerPoint.
Alvin. Okay. Let me just read.
Awesome. It's on screen. We may proceed.
Okay. Okay. Sorry for that.
No problem.
You can hear me?
Loud and clear.
Okay.
Loud and clear.
Thank you. So let's talk about what is palliative care. We start by defining what is palliative care. Palliative care is an approach that improves the quality of life of patients. That includes adults and children and their families who are facing problems associated with the life-threatening illnesses. When we are talking about quality of life in this definition, we are looking at the patient who is suffering. What about the family members who are taking care of the patient? As we know, when a family is taking care of a patient with life-threatening illnesses, they undergo a lot of stresses, financial constraint, and that's why palliative care goes to an extent, including the patient relatives into the care. And we say in palliative care, it starts through the prevention. That prevention is when we go outside in the community, we create awareness on how to prevent the illnesses. Then again, and relief of suffering by means of early identification, by realizing if we talk of cancer, do we know what are some signs and symptoms? Are we able to identify early enough so that we are able to give proper treatment or even intervention? Then by correct assessment, this we call it holistic assessment, where we are able to assess the patient wholly, not just physical assessment, but we go into psychological, social, spiritual issues, and the treatment of pain. As we know, majority of us in developing countries, we seek treatment when we have some pain. We don't have time or we don't have resources to go for medical checkup. So this we need to, when we are talking about palliative care, we need to check on correct assessment and treatment of pain, as well as other problems, physical, psychological, and spiritual pains. And these are some of the pains that palliative care takes care of. When we talk about physical pain, we are talking of pain, whatever the physical, whenever headache, abdomen, whichever. Then we have fatigue, we have nausea, insomnia, lack of appetite. These ones depend with what condition does the patient have or the client. And also in physical pain, when we talk about in the family members, the carers, what about fatigue? They get a lot of fatigue caring the patient, and also the in and out travel to the hospital for clinics. Then we talk about social pains, where we have lack of finances, as majority or most of the life-threatening illnesses, chronic illnesses, it requires a lot of finances. And the family members, friends, they get drained, and that impact the socialization. Then we have loss of role in the family if the person who is sick and is the one who was providing the family. And again, they feel lonely. Since you are at home, you are taking your treatment, you are not able to go to work. You're not able to socialize with others, friends. If you used to go and have some coffee, at the moment you are not able. So patients feel lonely, and also the family members, they have that feel of loneliness because of taking care. Most of the time they are taking care of their loved ones. The other one is psychological pain, where we have anxiety, depression, confusion, anger, fear, sadness. And all these come as the patient has been diagnosed throughout the treatment. As by the time we are finishing curative treatment, they are going to the palliative care. We know the patient already, they are overwhelmed by physical pains. Socially, they are overwhelmed. Now, depression sets in. They get confusion. They don't know where to go, what to think about their illness, what to think about their family, what other people are thinking about them. Then the anger can be can be projected to anything, either the family, either the hospital, the doctors, and this is where the palliative care providers, they come in supporting the patient and the family members. Then spiritual pain, this is where people ask, or client ask, if it's a punishment from God. Maybe they were church leaders, they were imam, then on the process they get this illness, and on the process they have so much unresolved issues, and that's where we bring in the spiritual leaders to the patient and the family members. When we go back to the statistics, globally, approximately we have 56.8 million population that need services, and only 78% are living in low middle income countries, where our country is Kenya and our county Kajiado, but only 12% have their needs being met. When we talk about 12%, we are thinking of which hospitals, how many healthcare providers are providing palliative care services, how many hospitals they have palliative care units, or do we have hospices where to refer the patient? Do we have multidisciplinary members to take care of the patient? And that's why we go below even 20%, especially in our countries. Then we have 69% account for non-communicable diseases. This includes all non-communicable diseases, and it takes a lot of the health system, manpower, and resources. Then every year, we have 8,000 Kenyans that need services, while only 14,500 as they are able to access. Sadly being only 5% of our children who requires palliative care, they are able to access the services. We know in palliative care, majority of our non-communicable diseases, mostly they are in tertiary hospitals, and majority of Kenyans, they live in rural communities, and reaching to those tertiary hospitals, it takes some time. When somebody you are referred, and you go for clinic, return, you get overwhelmed, and there goes back to social pain and psychological too. So that 5% is only where we think of. Maybe like Kenyatta National Hospital, where we have those wards, an example of cancer wards or the unit, and some of the county hospitals where they have palliative care unit or some hospices, but we know majority, they have not started the service. Who are our care providers who are supposed to offer these services? As I started, I said palliative care is offered by multidisciplinary team who are doctors who cut across. If it's a cancer patient, we need to get a oncologist, a radio-oncologist. We have surgeons if we are going in for surgery. We have a physician who takes care of patients with diabetes, hypertension, epilepsy, all those patients, pediatrician again, and some who are specialized in different specialty. Then we have nurses. Majority of palliative care is offered by nurses, and those include nurses who have been trained as trauma nurses, wound care, renal care nurses, critical care, pediatric patient. And this is where patients are able to get a specialist care, a nurse who understands the patient condition, is not just a general patient. And this is what we are trying to see, if our counties, they can have specialist nurses in all fields so that our client, our patient, our families, they are able to to achieve, they are able to get the services, not just traveling to other counties for services. We have clinical officers, counselors, social workers, nutritionists, physiotherapists, community health volunteers, patient carers, and family members. In palliative care, care providers, we include the patient carers and family members. These are three categories where it's very important in palliative care. Like community health volunteers, they are the health providers in the community level who are able to receive the patient as they have been discharged from the hospitals, and they're able to refer and also monitor how their community is doing, and they're able to check how they are taking the medication and remind them about their clinic return dates. Then patient carers. These are people who are trained to take care of the patient at home. Could be family members, could be a friend or a neighbor. Then we don't leave family members because they're the ones who live with the patient and they stay with the patient in the house, at home. So all these combined, we need to have to create awareness of what is all this palliative care. If a doctor can do their part, then supported by the nurse, clinical officers are there, are the counselors supporting the family members, social worker, have we gone to their home to understand where the patient comes from? How is their social surrounding? What are they able to afford? How are they living? How is the support in the neighborhood? And this is where we say about compassionate communities. Compassionate, we need to bring the neighbors, the friends, so that when we are assessing, when we are referring the patient for home care, for palliative care, that they can't be admitted anymore, how is their surrounding? Who are the social support in that community? So palliative care, we train those caregivers and families on how to take care also for themselves, because they have to get self-care. As long as they are taking care of the patient, they need also to take care of themselves. So the next is, why palliative care? Palliative care can be helpful at any stage of illness and is best provided soon after a person is diagnosed. This is where now we are able to bring in, if a person has been diagnosed with non-communicable or a condition requiring palliative care, we are able to bring in a counselor. We need to bring in a social worker so that we can walk together the journey with the patient. Then to put the patient desires, goal, and decision first, where you have the patient understand the illness. Then on the process, we go to the understanding the treatment plan. If you are diagnosed today, what is required of you? How many revisits? How many the cycles? What's the treatment? Where will you be getting the treatment? Then again, counseling and supporting care during diagnosis. Remember, this is where if we don't take care of our families, our friends, they get overwhelmed by getting the diagnosis. Maybe somebody has been going with their own activities. Then on the one day, they just start having abdominal pains, back pain. Then within 2 months, they go to the hospital, some investigation, then they're given PAP. This is happening in your body. And that time, if counselors, they are not around, the nurses who are trained in counseling, in supporting the patient, they are not there, then the patient might start having depression before the treatment. Then we have what we call care planning, treatment, clinic, revisit, and after the treatment. We all know when the patient is diagnosed, we need to have a care plan. And it's the patient right and the family right to ask and to get the care plan from their doctor or the nurse who is taking care of them. Then the same health providers, they need to take the patient through about the treatment, about the clinic revisit. We are starting the treatment now. You are supposed to come after what long? After 1 month or after 3 weeks, and the reasons for revisit. Then again, if we finish the treatment, the patient need to understand. We need to, they'll be having follow-up clinics so that we continue checking on them. And that's where we say palliative care goes through from diagnosis up to the bereavement in support of the family members. Then we support the patient and the family members, improve the quality of life through the 4 domains, where we said is physical, psychological, social, and spiritual. Then provide pain and symptom control, assessing, monitoring, and evaluating the patient. This is key when we are training community health volunteers, caregivers, and also the family members. If the patient is on this medication and the medication is indicated, is 1 times 3, is morning, lunch hour, and evening. Are they able to have a chat, or are they able to have somebody to assess, to monitor that patient is taking the medication rightly? Then on the process, evaluating the patient. If you are given the treatment yesterday, now it's after 72 hours, how are you feeling? Any improvement? And if the patient continues deteriorating, that's where we tell the caregivers or the family members, they have to return the patient to the clinic. And this must start from the time the patient starts the treatment, where they are doing the plan with the doctor and the nurses who are taking care of them. Then palliative care focuses on body, mind, and the spirit. Reduces unnecessary hospital visit by having a healthcare provider at home for monitoring. This one, we are a bit far in reaching, but as a country, we are trying in palliative care, not like more. We are doing much better in African countries, and we need to embrace supporting patient at home, because we know congestion in the hospital, family members on and off visit, the visiting hours versus working hours is a challenge. Then on the process, infection prevention at home is better than hospital, especially for the low immunity patient. So when we talk about who requires palliative care, we have clients who have been diagnosed with cancer, we have dementia. Our elderly persons, our older persons, they are most affected. I may say, even in our Kajiado, I've gone across Kajiado County, our elderly patient or persons, they are not getting quality care as required. We have hypertension, patient with malnutrition, patient with renal failure, cardiac diseases, and also we don't forget about family members who are taking care or who are related with the patient with all these diagnoses. They need our services, and our services says just sitting there, counseling the patient, let the family members have somebody to talk to. Counsel the patient, work with the family members as they are working with their patient. Because when we don't take care of family members, then they are not able to give back to their loved one. They get burnout. And that's the time you hear family members say, we want this person in the hospital. And by the time you are coordinating about admission, there are no beds, and you are told to go back to at home again. So with this is where we are bringing in compassionate community, bringing in the family members the patient, and also the neighbors, so that we can able to support our own. Where we live is our home all. If you are neighbor to that patient, you are part of parcel of that person, because socialization begins from our homes. Then we can't forget person with long-term care facilities, such like TB patient who take treatment for a long time, psychiatry patients who are left, especially their family members, nobody takes care of them. We think huyo mwenda wazimu, but always remember that person come from a family, and that family needs love, need to be understood, and need to be given some guidance. Then we can't forget babies born with congenital malformation or mentally retarded. At least when we are where you live and you have somebody with this, can you just refer? Let's network, let's know what support we can give our loved ones. Then palliative care service should be accessible to all persons with special needs and should be tailored to address the need of special populations. When we are offering palliative care, every person has different needs, and by doing holistically assessment, doing the correct assessment, we are able to understand what this patient needs and what the other one needs. Because not all, even though they have the same diagnosis, we can't say we are offering the same palliative care. Every person is a unique person. Is it available in Kajiado County? I may say yes or no. So far, in Kajiado, we don't have any palliative care services. Either we don't have hospice, inpatient or outpatient. Our patient travels all the way to Nairobi County for services. But for other services we have in our hospitals, we have diabetic hypertension, epilepsy, all those clinics. But when we have a patient who is almost at end of life care, where we need to bring in the family members to support them, to walk with them the same journey, that one is lacking, because what we are offering in our hospitals in Kajiado is curative care. And this is the time, the Kajiado we want. We need to lobby for also healthcare providers from Kajiado County to be trained as palliative care providers so that they can support our community. But yes, we have volunteering services which are ongoing. But this one is about creating awareness, educating the community about palliative care, and also enlightening them on what are those procedures they can do at home. Maybe a procedure like how to turn a patient in bed, how to bathe a patient who has this and this condition, how to feed a patient who is bedridden, how we able, all these are small procedures that the volunteering services, the ONPACC, we are reaching to the community to teach, and we are to educate them through organized groups, through churches, and also when we are called upon. There are challenges: inadequate workforce to provide holistic palliative care services at different level of care, lack of recognition, motivation, and inadequate support for palliative care providers, unaffordable prices of essential medicine and commodities for palliative care. Then we have low demand and negative attitude toward opioids, prescription and dispensing, inadequate access of palliative care services across level of care, with poor community leakage, and palliative care has to start from the grassroots as we move, referring from the community dispensary or to far and again backwards. Then we have limited access to proper information on palliative care and service availability. It has not been there It's a new, but we can't say it's new because it's over 20 years in our country, but only that is not that curative. When we talk about palliative care, supporting people, they don't understand what is that service. So I worked at Nairobi Hospice for more than 10 years, and we used to visit patients with 20 kilometers radius, because Nairobi Hospice do home-based care and outpatient. So we could come round Keserian, Rongai, Ngong, and back to Nairobi. But after Keserian, we are not assessing, because the policy says 20 kilometers radius from Nairobi Hospice, which is situated at Kenyatta National Hospital. So Stella, living in Kajiado, thought of what about the communities we are not able to reach? And with those ideas, I brought up some other healthcare providers, other trained nurses, friends who have had patient or relative affected by one or either. And Ongata Ngong Palliative Care Community was born. It's a CBO registered. And our aim is to promote awareness and educating all stakeholders. Here we talk of creating awareness also in schools. We have been doing this for several years, especially in Kajiado West. We have been working with Kajiado West sub-county. A majority of churches in Kajiado West just creating awareness, ensuring, supporting, encouraging the patient to go for clinics, to take their treatment properly, educating groups, organized groups, either women groups, and supporting them at home. That is by when they get a patient, they call one of us, we are able to go and visit and give support where we are able. Then we have bereavement support. In case a loved one passes on, we still continue supporting the family members. Referral system to the hospital and back to the community. ONPACC believe in referrals and believe in working together as a team. If a patient is at Orekemge in Kajiado West, that patient need to be, if they are not getting proper treatment or proper care, they have nobody at home, they need to be referred to Oretepesi health facility, and there they can refer to Ngong or Kenyatta. So referral is very key. And also when they are referred from other hospitals, this is where now the community health volunteers, they are given ways how to support the patient to come back to the community and to support them by monitoring their medication intake, checking how they are going, and they can give us a call and we are able to reach to them or even talk to somebody else who is there, and they are able to review the patient. Nutrition support is the most challenging part in ONPACC, because sometimes we go visiting patient at home. You want the patient to take medication, but we don't have food. They don't have food. So it becomes again a challenge, because you have to carry something for the patient as you are taking medication. But again, in palliative care, we believe in what the community have, what is accessible to them. As we are supporting them, as ONPACC, we don't have medication, we work closely with the other hospitals and hospices to support them. So when we go to the visit, we assess, and that we do with counselors and also social workers who are able to assess the community and the family at large. So Then we have limited access to proper information on palliative care and services. As we go to the community, we get people, they don't understand what is this as palliative care, because they know a patient needs to be in the hospital, but we are talking about patient having quality of life at home if they are not having curative treatment. Then we have inadequate information, education, communication materials on palliative care and hospice care. So ONPACC, we organize with the community, we go create awareness, we tell them about the referrals. Then we go to the young ones in the community who are supposed to be taking care of the older persons, and also informing them or even discussing on how to support them with nutrition as they're taking medication. The older persons, what they need, because sometimes they require more support than medication. Lack of nutrition in our county is the key area, which as palliative care, we are trying to, as ONPACC, we are trying to move on to support, but with our CBO being a CBO, all of us, we are working, but we create time. We are not able to reach everyone. When the community health volunteers, when they have a patient at home, they have our numbers. They are able to call us and we visit the patient at home. If the patient, then on the process after assessing, we are able to know if the patient now requires hospital admission. And this one, it's ongoing with his friends' support. Then we have UBORA Health Care Services. This UBORA came after starting ONPACC. I came to realize I'm giving the information only. We are creating awareness to the community down there. What about the urban? Where the urban people are working, they go to Nairobi, they go to Ngong, and they don't have somebody to live at home with their loved one who is sick. And that's where UBORA Health Care Services was born. And this one, we work with trained palliative care doctors, nurses, social workers, all of us, and we give, if we assess a patient and the relative, they are able to have a nurse at home, or we recommend a nurse or a nurse aide, then we are able to recommend and they're able to pay a bit of fee so that the person who is taking care of the patient can have a bread. And this is where we give also, we supply medical equipment, maybe like walking frame, walkers, and wheelchairs. We work together. We can get also for them for hiring if they need so. We train, as UBORA, we train caregivers. If you have or somebody has a patient and they want their own to be trained on how to feed, how to turn, how to bathe the patient, how to support the patient to walk outside for some sunlight, then we are able to come in and support them. And this is where we are able to visit the patient at home. Like the first diagram, there is a nurse, there is a clinical officer trained in that, and we have a community health volunteer. And that CHV trained, they are able to assess and continue monitoring and supporting the patient. Remember, we talked about psychological support. Then in case they think there is a need for specialists to come and visit, we are able to come in. Then again, we can have a family meeting, a family conference where we are able to enlighten the prognosis. I mean, how is the patient going? How is the patient doing the treatment? Then the patient and the family members, they are able to ask or for any clarification about their patient. So in UBORA, our aim is is companionship, where a patient is not left alone. They have somebody at home, they have a friend, they have family members. We are the community. Are we taking care of that? Then the older persons, we get medication and reminders of how they are taking. If we are having a nurse at home, we are having a nurse aid, then we get all these services. We don't give, and we don't recommend for nurse aid where we have very specialist thing like any post-operative care. Maybe for supportive care, for daily living activities, we can recommend for just caregiver. But there are some conditions where we need a nurse who is able to monitor oxygen or any other equipment being used by the patient. UBORA Care Services don't work alone. We work together with other organizations, and that's one, the main one is the community, where the community, they are able to call us to tell us or to inform us about the patient, and we are able to go and visit the patient even in the hospital or in their home. Then we work closely with Nairobi Hospice, and Nairobi Hospice, it is our main supporter, because when we have a patient who requires pain medication, let's say a morphine, tramadol, the strong opioids, we are able to assess. Provided we know the patient diagnosis, we are able to refer them to Nairobi Hospice, and they work together with us. They come with their vehicle to assess also the patient. We are working like we are working in the background, but when we get is something that we are not able to handle, we bring in Nairobi Hospice so that they can able to support us with medication, with the follow-up with the other clinic. Then Kenyatta National Hospital, especially palliative care unit, in case the patient is being discharged from Kenyatta, they are able to pass through PCU. Then on the process, they are referred to us, either UBORA or the community, the ONPACC. Then we can't leave health facilities which are near the patient or client, because that is where the patient will be taken there in case they have an emergency. We have Kenya Hospices and Palliative Care Association, our body, and they have been very key in supporting us. The posters, most of the health centers, dispensaries in Kajiado West, we have posters on how to take care of our patients, pain management, symptom management, and also the referral system. We can't leave International Association for Hospices and Palliative Care, our umbrella internationally, because as we are doing our work in the community, we work under one umbrella, and that's the KEPCA, Kenya Hospices and Palliative Care. They know what we are doing in the community, and also International Association, because they give materials to educate and they support. Also, we have the support, because you can't continue working with life-threatening patients for a long time without self-care. It's draining, and also the caregivers, they get burnout. And that's why we may say majority of healthcare providers, they fear venturing in palliative care field, because it's a lot of stress and a lot of baggage. You carry a lot about yourself, family members, patient, and the community. So when we are talking about palliative care aims to provide hope. We are providing hope to that patient. We are providing hope to that family members. Then, as that patient is going through the treatment, we need to enhance dignity and we promote resilience. I may say we have 5 stages of palliative care. As the patient is being diagnosed, we need to create a plan. We need to prepare the patient emotionally so that as we start the treatment, they are able to understand and the mind is set for that treatment. Then the early stages of care, that is where we are doing the curative treatment, supportive, or that. Then when it comes to late stage care, we are supporting the patient at the end of life. Remember, end of life care, it comes with a lot of stressors also to the family members. And this is very key as we walk the journey with the patient. After our loved one passes on, we need to support the loved ones. This is a very key area and which we are not able to support as the community. If a person passes on, all friends, neighbors, family, they start meeting, they come support that family. Then towards the end, they increase more. Then on the process after the burial, nobody appears in that family. And that is the breaking point for the family members. So as Kajiado County, as we want to improve our health, our society, so that we are able to have, we can have ourselves be able to continue with what we are doing. We need to support our loved ones, friends, families after the burial. And this is where in palliative care, we talk about bereavement services because the family has lost their loved one. We come in supporting the family members. And with that, if we come together, hold our hands together as healthcare providers, as community and the government, we are able to support each other and we are able to get quality of life. By the government, creating the opportunity, supporting healthcare providers who want to go and advance their training in palliative care. The community, supporting the community health volunteers. The neighbors, the friends, supporting our loved ones. Let's create a compassionate community where we care for each other. And with that, I say thank you for any questions. Hello. Hello, Benjamin.
Hello, I'm here. Welcome back, Alice. Stella.
Yes.
I have a question from Nancy Murithi.
Yes.
She is asking, how can the community support a family after loss of a loved one?
Okay. We need to incorporate the community early enough so that they understand the patient, what the journey the patient is going through. And by talking about the community, is the community where we live in, and also your friends and families. By supporting them is that you walk with them in the journey throughout the treatment. Then after they have lost their loved one, we are able to get a support group. What we call support group is that we can bring also the families who have lost their loved ones as a counseling forum, as sharing experiences. And also for the patient themselves, we are able to bring in a patient who is undergoing or who has gotten ill to support them.
Thank you for that. I have another question from Lina Mwash. How can one join to support your activities?
We are open. You can contact me. We have a website, and we do this during our free time, especially weekends. During our leave time, our off duties, you can get in touch with me. Then we can direct you on which side. And we don't talk about, we are not saying about healthcare providers only. You can support in any other way. If you're a counselor, if you're a social worker, if you are able to go and visit a patient, just support the patient, be there with the patient. We welcome that. And also sometimes we go to patient home and we invite a group and we cook together. We eat with the others in the community. So we welcome any person who want to come and support us.
Okay.
Yes.
Alice, you're back?
Yes, I'm back. I don't know if you can hear me.
Yes, can hear you clearly.
Okay, thank you. What an amazing and eye-opening presentation, Stella, and thank you so much for that. We have another question from Nancy Mureithi, who asks, how do you support the caregiver? Because at times they become emotionally drained.
The caregivers, as we are visiting the patient, let's say like in Nairobi hospice, if a patient, they live in Nairobi, Nairobi, we talk about Ongata, Rongai, Keserian, Ngong, they are able to join Nairobi hospice on Thursdays, where we have a support group, and also others if it's inside Nairobi, but now we are talking of Kajiado. Kajiado, we refer them to Nairobi hospice, where they come together and they share what they are undergoing with the guidance of a counselor and a psychologist.
Okay. I think that's all for the questions. I have a question myself. I think you've really captured a lot about the realistic situation in terms of what's happening in Kajiado and in Kenya in general. And excuse me. And I think there's someone here who has also said the statistics are shocking. So would you have any success stories or examples of where we have seen some really positive impacts from which we can draw as a community and emulate?
Like another county?
Yeah, or even just a small community within Kajiado itself, or anywhere within what you've experienced.
Okay, let me talk on my side. ONPACC, if we are able to walk, to go to Oretepesi or the Kemge, Saikeri, they are where we have trained community health volunteers and the community at large through the churches. You can feel the environment or what they express is different from another area because they understand this and they're able to support. Because we talk of, if you visit a patient and that patient has no firewood, that carer, that community health volunteer, they're able to go and fetch firewood for that client. And that's an example. Maybe we are not able, as we said, we have limited resources because we are volunteers to go across the Kajiado, but at the moment we are doing a bit of Kajiado North and more of Kajiado West.
Wow, that's amazing. Yeah. So the support goes just beyond the health element, but also the physical, and everything that encompasses what the family or the community is going through.
Exactly. Okay. When we talk about palliative care, we don't focus on the physical only. We are talking about that psychological issues of the patient and the family members. We are able to sit with them, do counseling and support them because maybe they have anxiety of the treatment. They don't know how socially, they don't have where to get the money for the next course of treatment. Or maybe they don't have food, then we are able to come together, ask friends maybe to support that family. I may say like an example, you might go visiting, you are called, you go to visit a patient at home,
Mm.
you find that person lives alone. The family members, the children, they are not there. They are not supporting. And you want to support, you want to clean that wood. You clean the wood, you have the medication, you clean. But now as you are leaving, you ask, yes, I've given this medication. What will this person eat? How are they going to maintain the medication? Then again, the drawing board again, we go back again, looking for somebody to support that unga. Maybe nutritionist to tell us, how can we get this and this? So it's a holistically care, it's not medical care. And it can be offered by anybody. A family member, a community, whoever has a heart to support palliative care cut across, not only healthcare providers.
Sure. Wow. That's amazing.
Yeah.
And over and above that, I think it's also good for you to hear what the people have had, the listeners have had about your presentation. We have Emily Odor who says, I'm very proud of my mentor. We have Dr. Nasieku who says, good job, Stella. We have Shamita Omote who says, great presentation. Stella, keep it up. JK says, statistics are shocking. I agree. Shamita Omote again says, creating hope to cancer survivor is most important support. Indeed. Kate Mutia says, good job, Ms. Stella, service to humanity above all. Susan Gishuru says, very informative. Thanks, Stella, for sensitizing us on palliative care. M. Kerubo says, thank you for this important information, Stella. Angasa Felix says, very informative, Madam. Wash hands. I think you must be known also for telling people to wash hands. Kenneth Kaunda,
During COVID time, we did that a lot.
You are mama. Now, wash mikono.
We carried a lot of jerrycan in every bomber. We were putting some jerrycans.
Right, fantastic. Kenneth Kaunda says, wow, quite timely to many suffering without compassion, indeed. Nancy Mureithi says, awesome, Stella, we are proud of you. And she also says, kudos. Alice Kemunto says, great. Nancy, I've asked that question. Alfred Juma says, thanks for awareness, madam. Lina Mwash says, this is great. Emily Odor says, I can testify that early initiation of palliative care brings out positivity and good physical outcome. I think we all agree to that. Yeah. Kenneth Kaunda asks, do you incorporate spiritual support? I think you said you did, but you can talk more about this.
Yeah, that's why like when we go to the communities, remember we believe in God, and we need to get the person where that person, if it's a Muslim, it's a better, wherever where you go, we need to ask you what you believe, what you do in that. Then we incorporate your spiritual leader inside in our care. And that's why when I started, I said we go to mostly creating awareness in churches. Remember, we have a lot of issues, and most of our churches, or whichever, we believe in praying for healing, and that is part of us. But we want to say we incorporate that because it's spiritually, but we give also the physical, we give the treatment. So incorporating, we have several pastors, different churches who support us, and they're in our community. And also when we are working, when we are going for creating awareness in the community, or a clinic, the outreach clinic, we have some who accompany us during the activities.
Wow, this is amazing and very eye-opening and inspiring, actually. The work that you're doing is inspiring. I hope you know that the community is behind you. We are rallying behind you. And thank you very much for talking to us about the important work you're doing through the two organizations. And certainly, I'm very sure you will have quite a number of people, as they have put in the comments, coming up to you to ask, how can we volunteer? And that's really such an important role. Personally, I didn't know the extent to which palliative care goes beyond just the physical or medical. It goes to emotional, spiritual, and that's really important. And also supporting those that are providing the palliative care, that's really important too.
Very important.
So thank you so much for covering the whole the whole concept so holistically and in depth. And I know it's 9 o'clock, you're tired, so I think we don't have any more questions. And so with that, I think we can say asante sana. Thank you so much, Stella, for this. It's been amazing,
Thank you so
and I
much.
hope that you'll be able to come back again, and
Sure.
and give us another testimony of how things have turned around and people have come through and changed the narrative.
And let's work together all to improve our communities. You
Right,
can
right.
give whatever you give. You can give the small you are able to give. If it's your time, just give that 5 minutes. Listen to that patient. If it's
Sure.
just having an extra cabbage to give that patient to eat, please just do it. Let's work together for better health.
A better Kajiado. And we also obviously look forward to seeing a hospice within Kajiado itself. So that's certainly on top of the priorities for sure.
Yes, I'm still working with the Kajiado County.
Yeah.
We hope soon we'll get something, because we need to differentiate between palliative care and oncology.
Right.
Because people they don't differentiate between two. But oncology is just cancer care alone. It's treating cancer, but palliative care cut across all other conditions, and that's what we bring in the family members and the community at large. Kajiado we want, we better work together to improve it.
Thank you so much. Thank you for walking the talk, and thank you for being part of the Kajiado we want. And I think with that, we can say we are out. Thank you very much to everybody who has taken the time to sit and listen to Stella. I think you'll agree with me. Her presentation was amazing. And so thank you so much for joining, and we can call it a night. And thank you again very, very much.